to joke around our office, don't drink the water, because as you know, a lot of women became pregnant about the same time here. Good morning, Arizona especially, but there might actually be something to what you drink or what you eat when it comes to getting pregnant. Dr. Leila Turner joins us this morning with a look at some of the food and the drinks that might actually help you get pregnant. Good morning.
Good morning.
All right, I'm looking at some of this stuff. I think I'm clear because, I mean, even though I love broccoli, I haven't been eating it a lot, but let's talk about some of the stuff you got here. You got some silk, you got some broccoli. Let's talk about how this works in terms of fertility.
Okay. Well, I like to educate my patients about how to eat a very balanced diet for fertility. So coconut milk, for example, coconut milk is an excellent source. It's an alternative milk for patients that might have food sensitivities or dairy intolerances. Coconut is also a supportive for your immune system.
Okay.
Coconut water. This is an excellent way to replace your electrolytes. It actually has a similar constitution as our blood plasma. So you've probably heard of drinking coconut water after a workout.
Now, how does this work? I mean, how does this kind of connect with
fertility.
Conceiving a child?
Well, let's talk about the fats, for example. Okay. So we've got the eggs, the milk. Fats are essential for making hormones in the body.
Okay.
Cholesterol is a precursor to estrogen and testosterone and progesterone. So if a woman is deficient in fats, her periods will become irregular. Okay. And then conceiving would be a problem.
Gotcha. Okay, so we got some broccoli over here and a supplement, fish oil.
Fish oils, so you're making a baby. Babies' brains are mostly fat, and so replenishing those essential fatty acids, we call them the omega-3s, those are needed for making a healthy baby brain.
This stuff, the stuff that is, I guess, in it that helps your body, the nutrients, I should say. Some women I've heard say they just take the prenatals as they're trying to get pregnant. Is that true?
Well, some women are very lucky.
It's all involving this stuff that's in the pill.
Some women can't get pregnant very easily.
Okay.
Other women, when they start having difficulties getting pregnant, you have to dig a little deeper and look at why. A common problem is not eating organic produce. Foods that have been heavily sprayed with pesticides or herbicides, those are toxins, and they are called endocrine disruptors, and they will actually throw off a woman's cycle. Your hormones will not work as well, and that can cause a problem. So if they're having problems conceiving, IVF is certainly an option, but I like to start before that.
Yeah.
You know, 90 days prior to conception is when you should really start replenishing these nutrients in a woman.
So you're a naturopathic doctor. Have you prescribed this to your patients? And,
many.
And how soon does it work? And how much of this do you have to infuse in your diet or change your diet before?
Well, it really depends, and it's hard to say exactly how quickly does it work. It depends on how deficient they are in these nutrients. I will say, though, that I have had a lot of successful pregnancies when you switch the diet. Diet is not just eating broccoli every once in a while. It generally involves changing your lifestyle and your diet.
So this is almost kind of going raw, going green, going completely healthy. You mean having one of these things in every part of your meals in the day?
For my women that have been trying to get pregnant for a year, over a year, they are willing to do anything.
Well, that's good information. And you know what, there is tell us about what's happening this Saturday, or I'm sorry, not this Saturday, but June 15th.
June 15th in Scottsdale, we're having a forum. 6 panelists, 4 doctors are coming together, and we will be discussing a whole variety of pregnancy challenges. I'll be talking about dietary solutions and support for pregnancy. There will be a discussion on IVF and fertility challenges. So.
What a great forum. Thank you very much, Dr. Leila Turner, naturopathic doctor. Now we know, April, you just had a baby, so now you know how you can get pregnant again.
No, thank you. But
right away.
Thanks, but no thanks.